The first gram is in. I'm drawing up the second one to give it right now.
Hey, I'm Dr. John Kotis from Kotis Plastic Surgery, and I'm with Sweet Pea, Pasquale. And we're doing a gynecomastia surgery. We're removing a lot of the fat over the superficial breast, and I'm also removing the gland here. You can see I've made my incisional markings here over the inferior portion of the areola. I'm going to liposuction this both in the superficial and deep planes, and you'll watch me do this. You'll hear in a minute. And again, I'm just putting in this fluid, and you'll see it'll turn like a white sheen. Okay. And we're done. Just kidding. No, we're done. So now I'm going to infiltrate fluid on this side here. And I'm going to give this a little time. I'm going to have my assistant also massage this once I get ready. But I'm making 2 little stab incisions on either side here, just so I can remove and sculpt the breast, because I want it to look really sculpted and chiseled and looking really, really nice. So as you can see here, I'm adding more fluid in here. And we'll put the remainder of the fluid in there. And I'm basically putting it both in the superficial and deep planes. And we'll equalize it on both sides. The other good thing about this is it prevents, you know, minimal amounts of bleeding, because it's got the epinephrine effect. And epinephrine actually vasoconstricts, which, you know, blocks a lot of the blood to the breast. So this is the power assisted liposuction device, which actually assists, and I'm going to turn it on before it's in the patient so you can see, and it basically vibrates and creates tunnels and makes it a little bit easier to remove the fat. I also use this device when I do my fat transfers, because I believe it doesn't do much damage to the fat cells at all. So you'll see me use this. What I like to do before I even do anything is I actually will turn this on and pre-tunnel to create tunnels along, you know, the periphery of the breast. Then I'll turn the machine on and then start removing the fat cells. What I'm doing is I'm in the deep plane, and I can feel where I'm going. You can see the cubic cannulas at the end here. And I'm just making striations underneath the skin without, I don't have the liposuction machine on at this point. I'm just using this to give me some sort of guide so that when I do suck out, but you can actually see the fat coming out and see it's pure yellow. What I like to call liquid gold. And again, you can see fat coming out. I'm not even sucking it at this point. I'm not even removing it. And I'm going at it from a different angle. And then it breaks up everything. And you can see how it's already coming out, and it's pure fat without any blood. And that's what you want. You don't want to have a lot of bleeding. As long as you're patient and wait for that epinephrine effect, you should be good. And you can see it coming out now. Sweet pea, you see that? I know you like that. Look at that, look at that. Now remember, this is only for fat. The gynecomastia portion, again, is something that we need to, you know, discuss. Is it's gland tissue, it's not fat. So you theoretically should remove the gland as well. And that's what we're going to be doing in this surgery. Okay, turn that off. And now we're ready to go on suction. So I'll turn my suction device on. You can see that fat going into my little canister right in here. And I'm going to start down low here. And now I'm actually starting to do the sculpting. And I've got a very fine cannula that I'm using. Fairly young patient. You can see it coming out. Get all the way up. Okay. See again the fat coming out. And he's not a big boy, I mean, but he's got some fat there. And you'll see once we open it up, it almost looks like Swiss cheese inside there after we made these cavitations in the fat. What I'm going to do right now is make an incision along the inferior aspect of the areola, as you can see here. And that's a difference in the color between the areola and the skin, as you can see here. So I'm going to make my incision along here, and I'm going to remove the gland, and I'm going to visualize removing the gland. Again, you don't have to worry about the blood supply. Blood supply is coming in from here, as you can see. And there's, you see the gland popping up here. You can actually feel the gland too. See, there it is. It's very firm, and that's the gland right there. See it? We're going to ride on that. We're going to ride right along this border right here. And I don't like to skeletonize and remove too much because you need some of the blood supply here. And my assistant's going to help me here. And I also like to leave a little bit underneath, and the reason I do that is because then it doesn't divot. You know, I leave a little portion, but you can see now this is all right here. This is gland. So we're just going to stay in this plane right here. And there you see the gland. Okay, I'll put a muscle right here. See? So I've removed the gland in its entirety. Okay. Yep. So again, we're removing the gland on this side, and you can see it coming out. And there's your muscle layer right there, see it? This one. And you can see it. It's very, very hard, that gland. And there's your gland right there, see it? It's covered in the white coating there, and that's your gland. So basically what I'm doing now, so we don't skeletonize the areola or the nipple and create a divot, I actually sew it with a little platform right in here. So it gives me a nice little, you know, shelf in which to do this. And I'll bring the edges together, and you'll see it'll come and layer up nicely. And that's what I'm doing right here, so that it doesn't create a cavity. I've got actually tissue underneath there, and I've left a little bit of tissue just so he doesn't indent. That's called a deep dermal stitch, what I'm doing right now. And that's it. And we'll give you a glance as far as when we're close. So now I'm putting Mastisol, and we're putting steri strips on, and we're all done. You can see what kind of a difference we've made here on his chest. Looks great. All done.